What is parotidectomy? Parotidectomy means removal of a parotid gland. Parotid glands are situated on either side of the cheek in this area below the ear. These tumors usually, most of the time, we don't even realize that there is a gland sitting here. These are parotid glands are what we call salivary glands. The function of the salivary gland is to produce saliva, okay, which lubricates the food and partially digests the food before it, and it prepares it for all the digestive process of the stomach and the intestine. So the saliva is secreted in the gland, which passes through a duct and through which opens into the mouth. On both sides, these glands are there. Sometimes you may have small tumors arising in this parotid gland. The most common tumor which we see in this gland are something called pleomorphic adenomas. They are totally benign, they are not cancerous growth, and usually patient may notice a small swelling in the below the ear or this part of the neck, and then the patient it may be painless, it may just be a swelling. So if you leave it like that, it slowly may increase over the years. But if there is a long-standing swelling, say for 10 years a patient had a swelling and suddenly it is becoming increased, that can be a sign of a danger. So, or suddenly the tumor which was not a cancer might have become a cancer. So if any swelling is there, you need to get it evaluated. Most of the time what doctors will ask you is, they'll ask you to get an ultrasound scan of this region. So that the whole parotid gland can be seen, and the parotid gland has got two parts. One is a superficial part which is there on this, just under the skin here, and there is a deep part which is behind, which goes around this jawbone and into the deep part of the face. So usually, if the tumor is very superficial, in the superficial part of the gland, usually it is detected. Deep lobe tumors may be a little difficult to detect, and there is a swelling which is pushing the whole gland up, that may be coming from the deep part of the gland. So most of the time, the doctor will ask you to do this ultrasound scan, which will show you the tumor. And after that, they may ask you to undergo something called an FNAC. FNAC is a fine needle aspiration cytology, which means the pathology doctor, the doctor who samples the tissues in the body, they put a needle into this particular swelling if you have in the face, and they'll draw some sample from it and see it under the microscope. That will tell us, most of the time, the tumors which are 90% of the time, it is pleomorphic adenoma. Very rarely cancers can happen, but if detected early and completely removed, they are totally cured. And so once the FNAC is done, you have to find, this is the diagnosis will be given to you. Most of the time, the tumors arising in this gland are very benign or not a cancerous growth. So then the next step will be, if the tumor is big enough and it is progressing rapidly, you might be asked to undergo something called a parotidectomy. Parotidectomy most of the time involves removing the superficial part of the gland, or if the tumor is little situated towards the deep, the total gland may have to be removed. Why this surgery is a little difficult than the regular surgeries? Because the face nerve, the nerve that supplies all the muscles of around the eye, the nose, the mouth, that nerve goes through the gland. So it comes out of your brain, travels to the ear, through this bone it comes out and enters the gland. In the gland, it divides into 5 branches and enters into all the muscles surrounding the face in a branched fashion. One branch goes here, one branch goes here, 2 branches come to the mouth, and 1 branch goes to the neck muscles and all. So when you're deciding for the surgery, you need to select an experienced surgeon who does this regularly. So this nerve has to be identified, and usually the surgery involves removing the whole parotid gland away from the nerve. And usually the tumor will be embedded in that whatever tissue we remove. We don't go and remove the tumor as such. We actually remove one part of the gland totally without making any damage to the nerve. That is called, usually earlier it was called superficial parotidectomy. Nowadays we call this particular procedure as adequate parotidectomy. But in some experienced surgeon's hands, it's a very safe procedure. And it is required to do in a characteristically more than 2 centimeter size tumor is present. And or if the tumor is present more than 10 years, there is a small chance of it becoming a cancerous growth later on. If it is your tumor is suddenly increasing in size, you have to think of getting it done rather than not. But if you are a very elderly person, if around 70 years you are detecting and it's a pleomorphic adenoma, you may even leave it alone, because in the lifespan you have, it may not increase that much in size. If it is just stable, you can leave it alone. But before taking that decision, you need to get a needle aspiration cytology and make sure that you are not dealing with a cancer.